Alright, this is going to be a pretty quick overview of the brain anatomy we're going to do in the second brain lab. When you do this work, we're going to do this in the back of the room again using the brain buckets that are on the central cart. Those will be the newest, best specimens for you to work with. You can also feel free to use the specimens that are already on the tables. Those are the med students' brains. Those will be a little bit more beat up from dissection work. So you have plenty of resources to work with. Just grab yourself a brain or two, and then you'll for sure need an atlas for today's work, because a lot of it is just identifying things that are there without actually any dissection steps. So you'll want some good visual references to identify the terms. You'll want to grab your objective manual for today. All the bold-faced terms are your objectives, so basically you'll just sort of walk through the narrative and identify all the things that are in bold. And I think there's only a few things that give people any trouble on this dissection, and we should be able to help you with those as you go. So I'm just going to sort of orient you to a couple of the key views and some of the things you'll be able to see. We're going to start with a lateral view. That's probably the easiest and most familiar view of the brain: frontal, parietal, occipital, and temporal. I hope that you'll spend the time to really figure out how to draw those definitive boundaries. Obviously the temporal lobe is quite simple because of the large lateral fissure. The posterior end of the temporal lobe, you'll be able to identify. If you look at the lateral view and you kind of pull it upwards, you can kind of see a notch happen right here, right above the cerebellum. This is marking the separation between the temporal lobe and the occipital lobe. So this is sort of a dividing line between occipital and temporal. The dividing line between parietal and occipital we can really only see from the medial view. So we'll see that in a minute when we get there. Between the frontal and parietal would be the central sulcus, and this one can be a little bit tricky sometimes. Depending on how separate the gyri are in your particular brain. Whenever I look at a brain, what I try to do is look at the frontal lobe, and there ought to be three roughly horizontal gyri. Here's one, here's two, and here's three. Each is a zigzag in and of itself, but if I blur my eyes a little bit, I can kind of see 1, 2, 3 gyri that are basically running anterior posterior. These are the superior, middle, and inferior frontal gyri. Where these end and we get a prominent vertical gyrus, this is our precentral gyrus. So this tells us that we're right at the end of the frontal lobe. And then the crack between would be the central sulcus, and then the gyrus behind would be the postcentral gyrus. So try to cue your eyes in on those clues, and that'll give you a good idea of the dividing line between frontal and parietal. Note the central sulcus will not continue down and actually, go all the way through to the lateral sulcus. It's not that complete. In this view, you should also be able to identify the insula. You'll need to pull away or pull down the temporal lobe, or in this case, I can actually just take off a couple small pieces to find the insula inside. Remember, it's just a handful of short gyri that are running up and down in that space as insula. Okay, so I think that's the main goals. There's a variety of other structures on the list, but we don't need to go through them all here. This will be good work to do in class. So then let's move on to a medial view. On the mid-sagittally sectioned brain, you'll be able to identify a lot of structures here. A lot of things related to the hypothalamus, the thalamus. The corpus callosum has several different components to it that are well identified in the atlas. You'll want to do a little bit of work on the cerebral cortex here. Here's where you can see that separation between occipital lobe and parietal lobe from the parieto-occipital sulcus that runs through there, the calcarine sulcus, which runs back horizontally where the primary visual cortex is at. The cingulate gyrus, remember we talked about that in the pain pathway lecture. And then also on this view, if you actually connect the lateral view and the medial view from this side, I can identify the precentral gyrus and the postcentral gyrus. If you actually follow these over the edge onto the medial, this section here, would be the precentral on the medial side, and this would be the postcentral on the medial side. These two structures together form what's called the paracentral lobule. So you'll want to have a look for that as well. These aren't so bad, I don't think, these medial view angled shots. If anything gives you trouble, it'll be stuff in this area because we're very small. I think the pineal gland is a structure that is on your objectives. This is also the epithalamus, so you have hypothalamus, thalamus, and then epithalamus or pineal gland. This will only be present if your brain has been sectioned right in the middle, or it's been off-center and you've got the larger half. So if you can't see this pineal gland in your cadaver or in your brain specimen, just have a look around. There's several. I saw some the other day, so I know that they're there. All right, next, let's go to the ventral view. Okay. I've got all the cranial nerves on here. We'll get to those in a second, but there's also some basic brain anatomy to identify from the inferior view. Things like the inferior structures in the temporal lobe, like the uncus, the parahippocampal gyrus. Those structures we should be able to find from the inferior. What else? Pituitary gland, you will not see that in your brain because those are still in the skulls of the cadavers, but you will be able to see the little stalk coming down the infundibulum, and that's going to be in close proximity to the optic chiasm anteriorly, and then posteriorly you'll have these mammillary bodies of the hypothalamus that are projecting downward, and I think that's probably a pretty good overview of some of the things you'll see in that area. So have a look around, see how much you can identify from that perspective. On the brainstem, we've got a few things. This is pretty descriptive stuff. On the medulla, you've got the two pyramids. These are these two triangular structures here where basically the anterior columns of white matter like broaden out to form these pyramids. And then you can, if you actually push the pyramids apart in the medulla, you might be able to see some of these crossing fibers at the decussation. You'll remember that from the motor lecture. Lateral to the pyramids, there's an olive on each side of the medulla, and those are going to be helpful landmarks for identifying the locations of the cranial nerves. Let's see, the other thing I think we might want to look at here, because it's a little bit non-intuitive, is the colliculi of the midbrain. These are actually on the back of the midbrain, so to identify those you need to sort of work all this, come from the posterior. Let me turn this around, and we'll sort of zoom that back a little bit. So you'd want to sort of pry all this open, and we ought to be able to get there. Oh, I can just see it there. If I pull this off, the whole thing's going to go, but you can see these little two little bumps in here. If you pull the cerebellum down, actually maybe I'll do that instead, and maybe we can sneak in there from the other side. Okay, and yes, there we go. Now you can see the colliculi from the back, so you'll want to try to identify those structures from the posterior. Okay, let's see, what have we got next? Cranial nerves, yes? Yes, indeed, there we go. Okay, so you should be able to identify most of the cranial nerves. Some of them are harder than others. Cranial nerve 1 obviously won't be here, but the olfactory bulbs and tracts may be, so have a look for those. This would actually be representing the small nerves going through the cribriform plate of ethmoid. You will definitely not have those. Nerve 2 and the optic chiasm, I'm sure you'll have those. Identify the optic tracts as well. Nerve 3 is pretty prominent, emerging between the border of the pons and the midbrain. You won't have much trouble there. 4, this one's pretty small, and you're actually better off trying to find this at its origin. This is the only cranial nerve that comes off of the posterior dorsal surface of the brainstem. So back when you were looking for the colliculi in the back, that's actually where the trochlear nerves begin. So you can have a look there for those. 5 is on the lateral surface of the pons. This is really quite large. It'll be cut short though to about here. You won't have the ganglion and all that business attached to it, but you'll probably have a pretty thick nerve stump there associated with that. Abducens, nerve 6, that's just as indicated here. It's usually quite close to the midline, and it's very small, so look closely for it. 7 and 8 will be found out here lateral at the junction of pons and medulla. This would be 7, and then 8's right next to it. These are out quite far lateral at that junction, and then kind of in the same area but lower or more inferior on the brainstem would be nerves 9 and 10. And these may just look like a lot of small, tiny rootlets rather than large nerves that have all converged together. The key for 9 and 10 is that they're both going to be found lateral to the olive of the medulla, so make sure you look out that far lateral. And that's different than the hypoglossal nerve, which emerges as, again, a series of small rootlets, but that's anterior to the olive and lateral to, or anterior/medial to the olive, and then lateral to the pyramids. So you'll be able to identify most of the cranial nerves, probably not accessory. On this side I've got accessory showing. Since that one comes up from the spinal cord, chances are most of that's been damaged during the brain removal. So I wouldn't set your hopes too high on that one. Okay, so that's your cranial nerves. Make sure you can identify those. And the last objective, or last area we're going to look at is the cerebellum. This is easy. There's just a couple terms, 2 hemispheres. And then this midline structure that connects the 2 hemispheres of the cerebellum is called the vermis, because it looks like a segmented worm. So identify the vermis and the hemispheres, and you're good to go on cerebellar anatomy for this class. So that's the big picture. This will be a good lab. We're going to be seeing a lot of structures we've been talking about, and the last few structures that we have left to talk about this week in lecture. So that's it. Enjoy the lab, and I'll see you in class on Monday.